Thanks for joining me again, Dr. Lim. How are you today?
Okay.
Good. Glad to hear it. Well, I wanted to take some time today to talk about what a good clinician looks like. So I thought I would ask you some questions on basically on how somebody can find a new therapist. So I wanted to start off with what steps should someone new to therapy take to find a therapist?
So depending on the age of the person, there are various factors. One of the things you want to consider as a client is to find somebody you can connect with. And remember, when you seek therapy, the focus is on building a relationship. While it may be, while you may be working on an issue, is your ability to connect with somebody at a very authentic level is very important because that allows you to build trust. And when you find yourself being able to disclose and when you're challenged in session, in a good therapy session, you should come away from the session feeling some level of challenge, some level of provocation that allows you to ponder and think about your issues. So you should be able to come away from the session rattled, where you are not maintaining status quo, but you are able to identify or at least able to think about the issues that you struggle with. And the therapist should be able to take you to some historical situations that help you pull out themes in your own personal work.
Okay, that's great. So you already answered this a little bit. But what are some specific qualities that someone should look for in a therapist?
Qualities, as a client, it might be hard to find the measurement. But if you're looking for a good therapist, find somebody who has worked on their own issues, because having worked on their issues will allow them to be able to see your issues as a client clearer. So somebody who has worked through their own issues, somebody who has some level of understanding connection, somebody who is able to challenge you and not be afraid of, you leaving if you are challenged. So you ought to think about somebody who is willing to take you to difficult places. So these are the things, and it should not be a place where, there's a lot of conversation, chit chat, and, just going through smooth waters. So find a therapist that's willing to take you to the rough waters and be able to hold you accountable, be able to help you look at historical themes. So those are the things I would look for in a clinician.
Okay, yeah, that sounds wonderful. I know, it can be kind of hard to spot those things if you've never been to therapy before. It's kind of hard to know what to look for, and it can be hard to see maybe some of the things that aren't good in a therapist as well. So, what are some red flags you would recommend people look for in a therapist?
Red flag is when you come away from sessions after sessions unchallenged, when there is a lot of talking about pieces of, you repeat a lot of things, but it becomes a session where you just share content. Because to me, that's not therapy, that's not effective work. So you should be able to look at processes and themes and look at things that you keep doing yourself and not be held not be let off the hook when you are, when your issues show up. So it's very important that your clinician hold you accountable, and it's not a place where it's a bought friendship, where it's just, we're just coasting. Because after you come away from a good surgery, there should be some level of hurt. So same thing, when you come away from a good session, there should be some level of emotional pain and some grinding. So your job is to work through it rather than just sail through it.
Okay. Yeah, so somebody that's basically really like pushing you to do the work, not trying to be your friend, not trying to essentially just take your money without challenging you. Definitely some good things to look for. I appreciate that. So I know you have a lot of experience with all of this. So what are some lessons that you learned the hard way as a therapist yourself?
Multiple lessons. Earlier in my career, you know, suffered the same, struggles with wanting to make sure I do it right. So in as a clinician, take out the do it right, but put in the transparency, the honesty. So the rightness of wrongness, being perfect has very little to do with therapy. What is important in therapy is to help the client peel the layers. So I struggle with that, and I was tiptoeing a lot. So after a while, after some growing pains, I saw the need to just be able to say what I see. So my three beliefs is that whatever I see, I feel, I need to say it rather than hold it in. Because your gift to the client is to be able to be direct, to say it, and to be able to let them digest it. Because one of the struggles I had was I was unwilling, you know, be it my own issue showing up, like with somebody who has status, somebody who has a financial means, and do not want to rattle the cage. So your job as a good clinician is to be able to rattle cages and let it sit where it may. So, so to take that seriously and not just tiptoe, because clients respect you when you are transparent, when you are able to say the very difficult things. So, I was more suffer under the, trepidation. So it's important to think about being transparent, giving them gifts of truths to help them grow in their journey.
Yeah,
And and also, the other early painful lesson was, sometimes prolonging therapy when the client is not ready for growth. So it's important to turn the relationship loose when effective work is terminated, has not, is not showing up.
sure. Yeah, and that sounds in and of itself like a way to be transparent that might be hard for some clinicians to do, by actually telling their client like, "Hey, this isn't this. We've kind of hit the end of our road together, and maybe you should take a break from therapy or something like that," because they're afraid of losing a client or hurting somebody's feelings, and so or even feeling like they're not good enough to get that client to growth, right? So maybe there's some stuff getting in the way there, and so yeah, I definitely appreciate that perspective too. So, so what would you say are some things that you are most proud of that you've learned along your journey as a therapist?
I think at this point of my career, I am proud of the fact that I can confront the client and not be afraid of their termination. Because I keep having this belief in mind as a strong clinician, effective clinician, to give people the gift of truth because this is what I owe my client. I respect enough to share, to share truth with them and let it sit with them and help them grow in their journey and not just be stagnant and be accepting of whatever. So to be able to point out hard truths and to be able to you know, let the things fall where it may. And if they want to
Sure.
continue in their journey, great. If they choose not to, it's because, some people are not ready. and not take it personally and not, do self-blame. So it's important to because people are different in their journey and not let their decisions impact me and take responsibility for it. So it's important to recognize that when you push a person, it doesn't mean that they always leave. When you push a person, it means that they may stay and work if they are very invested in their growth.
Absolutely. I think that's something that took me a couple clients to learn when I had a couple clients that would just randomly cancel on me or stop showing up. I definitely took it personally, and it was really hard to not tell myself like, oh, if I were good at my job, this wouldn't have happened, or something along those lines. And so recognizing that the client sometimes just isn't ready is totally okay, and it doesn't mean that the clinician is bad at what they're doing, but also yeah, being able to move forward and accept that is definitely really good. So all right, so next question I have for you, specifically as a professor of counseling, what is the most important lesson that you hope your students will learn?
Growth, personal evaluation, personal reflection is so important because as you grow and you are more true to self, you're more transparent with yourself, and you're able to, infuse healthy scripts into your own personal life. Because in your own journey and as you hold yourself accountable, if you take all these things seriously, you will you will be very effective in your work. So in training, I'm not, while while students are learning skills, what is important is the ability to hold yourself accountable for your own growth and to work through your issues. You know, being having worked through your issues will help you become a stronger clinician. So I'm not worried about the issues per se, but your willingness to look at it and address it is a very powerful experience. Because when you give yourself that gift, you will be able to help your client work through their issues. So important that we do self-reflections and and look at our own issues because we all come with issues. And to be able to open up boxes that may be indeed dark closets is very important and but yet needed.
Yes, yeah, that's where the concept of counter transference comes into play, right?
Yes, yes. Uh-huh. Yeah, the more we clean out our closet, the less countertransference might occur. So even in supervision, when a supervisor discusses a case, it's very often because there's countertransference, various various aspects of that, and it keeps showing up.
Yeah,
So,
okay. That makes a lot of sense. And so in what ways would you say that countertransference blocks the client from growth?
so because of the clinician's inability to look at their issues because they are um you know so to speak, they have kind of the eyes are blurry and they cannot see clearly, so then it limits the client's growth, and then it does not take the therapy sessions into a level of depth or growth that it has potential for. And then it may limit the clinician from helping the client grieve through some of their unresolved issues. Because in a healthy session, there's a lot of grieving because people are stuck because they have not addressed some of their grief issues. They have not looked at the past issues that have kept them from advancing in their developmental growth. And when we have countertransference issues, we are stuck in our own issues, and that too will be passed on to the client. So it's so important that we address our developmental stuckness or our issues that keep showing up, and be willing to take that to supervision and not be embarrassed about it because we all come with issues. And so to take that as a growth point. And then I believe that when clients show up with a certain issue and they show up in the clinical room, that's the universe's way of giving us the opportunity to work on ourselves. So that's a gift once again that keeps showing up.
Yes, definitely. Um, yeah. So to kind of bring it back around, if somebody is looking to start therapy for the first time and they're searching through all the therapists and all the options that they have, what's the biggest piece of advice that you would give somebody while they're in the process of selecting a therapist off of Psychology Today or Headway or anything like that?
I'm sure everyone who's searching for a therapist will read their profile. Um, I would suggest that you talk to friends and get a feel for who is out there that is effective and to be able to ask about some of the skills used to help a person dig through their pile of murkiness. So to be able to see which friends or which colleagues have a positive growth experience with their therapist, and not necessarily look for somebody who can you know, just be there for you, but look for somebody who's willing to challenge you. Because in any growth process, you have to go through the fire. You have to
Yeah.
be tested. Even in marathon training, you have to go through pain to reach your destination.
Yeah.
So be willing to look at that and be willing to say, I'm willing to do the hard work. So only
Hmm.
you yourself can do it. So to talk to friends who will give you good recommendations.
Okay. Yeah. So sounds like shop around a little bit, right? Just kind of like buying a car. Take your time and find somebody who is going to be a good fit for you.
Yeah, and
Yeah.
shop around for the dealer that will tell you the truth.
Yeah. Okay. I love that. All right. So do you have any final thoughts you'd like to share with anybody listening about finding a new therapist or finding a therapist in general?
Yeah. I applaud the person, for their willingness to look at themselves. That first acknowledgement is very healthy. And to realize that while therapy is painful, you go through a period of pain, but on the other end is a beautiful rainbow. So don't be afraid of yourself. Many times people are afraid of looking at the truth. They go, oh, it's ugly truth. No, when you work through that, a beautiful rainbow will exist, will show up. So give yourself that gift and be willing to take yourself into that journey because first you deserve it and respect yourself enough so that you take yourself into that growth process, and that gift will help you become a better person, better employee, better spouse, better parent. So as you grow, you give the gift to others as well.
That's amazing. I love it. The gift that keeps on giving for sure. All right. Well, I really appreciate you taking some time to talk to me today about finding a therapist and what it's like out there trying to better yourself. It can be really hard. It can be a difficult journey, and I love the idea of not being afraid of yourself and respecting ourselves and that sort of thing, and being able to find that through therapy. So I appreciate all that advice and positive thoughts about this process. So, and then yeah, I look forward to our next conversation for sure.
Thank you. Continue to enjoy the journey of growth.
Always.
Mhm. All right. Thank you.
Thank you.